I'm Dr. Florida Rahman from Dhaka Medical College, Bangladesh. I am an infertility specialist and also assistant professor in the Department of OB/GYN in Dhaka Medical College. Dhaka Medical College is the largest medical college and the tertiary care hospital in Bangladesh. And I have worked here for 4 years. Since my early days, I have also taken my PG training from here, and I wish to be a infertility specialist from my very beginning of my OB/GYN career. I have completed my diploma in OB/GYN in 2001 and FCPS in OB/GYN in 2004. And I have also completed my MS from Dhaka University from Bardem Academy in 2011. I am really excited to be here in IIRRH, India, which is the leading, one of the leading infertility center and also a training institute for ART, which was sponsored by Merck Foundation, which is Merck More Than a Mother. I get opportunity to get here by this Merck Foundation, and I'm very much thankful to them for this training which they provide to me, and also to this institution. It is an excellent institution for teaching and learning. I'm really happy to be a part of Merck Fertility Training program, which is a part of the global initiative of Merck More Than a Mother. There is the collaboration of Dhaka Medical College, which is my institute, with Merck Foundation, and under that collaboration I am here for training in infertility. In Bangladesh, scope of fertility treatment is increasing day by day, and the people are becoming more aware, but there are some challenges. Males are not available, who are responsible for about 30% causes of infertility. Even they cannot come to doctor, and semen analysis is one of the most primary investigation which you need for infertility treatment. They don't want to do that. It's one. Another, all the time the females are blamed for the infertility. So there is a social dogma, some rituals, some prejudice. We have to overcome that. And thirdly, there are some limitations for ART treatment. It's expensive and not affordable for all the people, like who are from low socioeconomic community. That's why we can't do all the treatment up to the end to give a healthy baby to the people for their poverty or like that. And another thing, in some cases there are some donor program needed, like hypogonadotrophic hypogonadism or primary ovarian failure, where we can do any ART without the donor program. ART centers have been established since 20 years in Bangladesh, but there are about 15 infertility specialists which are currently treating or who have centers. And about there are 11 centers in Bangladesh. Most of them are in Dhaka, and only 2 centers are outside of Dhaka. In Chittagong there are 2 centers, and there are so many IUI centers all over the country, but exact number of the IUI center I cannot mention. And there are, as I say, infertility specialists are 15, and embryologists who are trained or who have postgraduate degree, they are 5 in number. And many of the persons, they have a short course of embryology training. For infertility couple, we have all the options of infertility training, starting from primary infertility care, which can be done by ovulation induction drugs or by some advice. Then secondary level, like there are many IUI centers, and tertiary care, that is the infertility center, IVF center. There are 11 IVF centers which is established in private sector, but in government sector there are no IVF center. Recently in our institution, Dhaka Medical College, one center is going to be established and all the procedures have already done, and we'll do the IVF and ICSI there. Bangladesh is a developing country, not yet developed. So, and it is also a poor country. So our resources are limited. Merck in fertility training can enhance our training program so that I can serve our country in a better way. We can serve the poor people with less expense, and they also try to focus our underprivileged infertile couples. They can also Merck fertility program is important for making the embryology personnel. We have crisis in our country. The female are dominated by males, and they become victim of social stigma. So if a couple remains infertile, then it's the common tendency to blame the female only, and as a result they become deprived from their rights. The female become victim of violence, social harassment, and as a result there occurs multiple marriage to men, and then divorce can happen, and even they may lead to suicide. In our country, awareness about the male infertility is a little bit less. First of all, it's a male dominating society, so the male, they usually don't go to doctor for their infertility and for their workup. They always blame their female partner for that problem. And secondly, if they don't want to do even the semen analysis, which is the primary infertility workup for a male. Thirdly, if they do the semen analysis, they can accept it if the report is bad. So the problem is everywhere they don't go to the doctor, they don't consult, they don't want to explore their problems, and if it is exposed to the doctor, then they don't want to show it otherwise or go for further treatment, as it is treated as the people will look to them as they are important. So they try to conceal and hide the cause, and also they don't take the actual treatment. Before coming to this institution, I have some expectation to enhance my knowledge and experience in the field of ERT, and to improve myself, or to become enough to become competent enough to do infertility, especially the ART training, by my own. So and I also had a wish to see the recent advancement in ART, and I should say it's made up partially, because here the basic knowledge portion was very strong. It was well organized, structured, and it encompasses all the topics of ART. Even it includes the lab setting. And in practical session, I have learned a lot, starting from the TVS scan, folliculometry, and the TVS scan for endometrium and early pregnancy scanning, monitoring of the patient who is undergoing treatment for infertility, I should say the ART, and then in OT, OPU means the ovum pickup. Even they did me a chance of doing embryo transfer. So it's partially met, but there is the limitation in endoscopy training, and also there are some gap between the consultant and the training. It should be started from the basic learning, that is the ovarian stimulation protocol, then the follicle monitoring of the ART cycles, TVS scan, the endocrinology related to infertility, male infertility, the ART establishment of ART center, the embryology center, the embryology preparation medium, knowledge regarding the machine equipments, its maintenance, and then in OT, ovum pickup and embryo transfer. These all are new. The practical session is new for me. I have some basic knowledge. It was enriched. My advice to new aspirants that they must be motivated to do infertility training, and they must keep patience and have a desire for infertility, and to continue this training, and then it should be reflected in their practical life, so later on. And second thing, I have observed here, some of the people who are come from non-English speaking countries, they have much difficulties. So if they want to come from a non-English speaking country, they should learn English first, then should come here. And another thing, TVS scan is very much important here. So one should learn the basics of TVS scan at first, then come here, and at last try to learn more as much as you can, and try to retain it within it. And after going to your country, in your society, you have wish to spread your knowledge and experience to your society so that it can help your people. I have come from Bangladesh, which is an overpopulated country, and I work in Dhaka Medical College, which is the tertiary care hospital, and and overburdened with all the critical care patients. Here to establish an infertility center is a challenge. So with facing this challenge, we are going to start an infertility IVF center, and I will work there. I will try to do my best in that center for serving the underprivileged people in our country, and later on I can start my own center. I must be very much thankful to Merck Foundation for selecting me to get me this opportunity to get entry in this institute like IIRRH, which is led by Dr. Professor Kamini. I think it's an excellent center for teaching and learning, and Merck Foundation, it was possible. My dream came true due to the Merck Foundation's contributions, so that I will be always thankful to them. Bangladesh.